success stories that you had seen, Soumya, in your daily practice? I'm sure there'll be many of them.
Yeah, there's a lot.
Anything that you can share with us?
100%. So I think one of the success stories was with you itself. I won't name the patient, but there was a patient who came to you for multiple IVF cycles and 3 months of a rigorous diet, of having minocytols, of correct supplementation, losing about 10 kgs of weight. Touch wood, she's pregnant with twins.
True. I remember her.
Yeah.
She had previous multiple IVF failures, but everything looks all right. I mean, the egg quality is good, endometrium is good, sperm quality is good. The only thing that we could note is that she was on the higher side of the BMI.
Correct.
So we thought we would correct it before we try another cycle. And luckily the patient was very cooperative, very understanding. She stuck to the T, whatever was advised. Yep. And we're really happy that she conceived, and we hope that she goes through her pregnancy safely and delivers safely. Okay. So these days we have many women coming with endometriosis as well. So how does this diet affect women with endometriosis?
Yeah, so I think first it would be better if you would take the stage and give like a brief overview of endometriosis.
So, endometriosis is a medical condition. Endometrium is the cells or the lining of the inner wall of the uterus or the womb. When these lining is present elsewhere externally outside the womb, whether in the wall of the uterus or ovaries or the pelvic cavity, it is called as endometriosis. So what this external ectopic endometrial tissue does is that it causes a lot of inflammation, it irritates the cells around, and it causes a lot of adhesions that leads to pain, predominantly pain symptoms during menses, during intercourse, when they're passing urine or stools. So it is a lot of inflammatory condition. So how can we help these women through their diet or food?
Yeah. So like you said, right, so it's predominantly an inflammatory condition, and it's something that diet will not cure, just to put it out there. There is no cure for it, I think, until and unless you go laparoscopically and try to
clear the endometriotic tissue.
Exactly. So diet-wise, what we can do is we can help manage the inflammation or the symptoms that the inflammation is causing. So like you said, right, so pain when you are pooping. So we try helping manage the consistency of their stool to make sure it's soft every time it passes. That being said, I would say the umbrella for the dietary guidelines is the Mediterranean diet or an anti-inflammatory diet.
Correct.
When we say Mediterranean diet, what we primarily say is, again, a diet when you talk about carbohydrates consisting a lot of whole grains. When it comes to protein, a lot of lean protein, as well as fatty fish and plant-based protein at least twice a week. And healthy fats, especially olive oil. So just following a broader concept of this, implementing this, your symptoms could improve by about 20 to 30%. As well as now talking about the inflammatory triggers. I have seen people's symptoms improve by about 60% once they've eliminated gluten and dairy. So gluten is a protein that's present in carbohydrates that causes certain carbohydrates to be elastic. So like, for example, wheat, barley, rye, and oats. These are the four main nutrients or carbohydrates.
The stickiness of the...
Correct. So like when you're kneading a dough, you stretch it and you can see that it's stretching, but with rice, it doesn't stretch. So that stretchiness is what gluten causes.
Yeah.
So avoiding those foods, so wheat, barley, rye, and oats, is something that helps alleviate a lot of your symptoms. And again, eliminating dairy by at least 80%. I know in the Indian diet it's impossible to do it, but even by eliminating 80% of it, symptoms improve drastically.
Correct. So let us move further. How can we complete this discussion without discussing about the other half of the sky, that is about the men and the male fertility? So how does diet play a role in male fertility?
Okay, so I think firstly it's important to understand that even with male fertility, there are certain irreversible factors that diet can't help. You would know that better, I think.
Of course, age again is very important in male fertility as well. Apart from that, being overweight or underweight is not good. Also, smoking, caffeine, alcohol is complete no even for men.
Yeah. So whenever men do their semen analysis report, so before we get started, it's absolutely mandatory to do a semen analysis report. That would give us a better idea on motility, sperm count, the progressive nature of it, the quality of the sperm, everything. If someone does not have any sperm, I can't do anything. Diet will not play a very important role there.
Yeah.
Or if someone's gone for cancer treatment and they don't have any sperms, again, I can't help there. But where I could actually help is helping improve the sperm count, as well as motility, and again, quality as a broader umbrella term. So nutrition plays a very important role in motility, in count, as well as the quality.
So any specific foods that you would advise for this men?
Yeah. So usually, like how we put women on a prenatal supplement, I ask men to be on a prenatal supplement as well as focusing on their overweight or underweight again. Because research has said that babies, once of these men who are obese, they end up having the ability to have more adipocytes in them. So we ask the men and women both to be on a proper diet pre-conception. So first and most important thing is get rid of all smoking, even passive smoking, as a matter of fact. So standing next to someone who's smoking, getting rid of that completely, no alcohol, making sure you're not wearing tight clothing or jeans.
Very true.
That's, I think, the most important aspect, because the scrotum is supposed to be 2 degrees
lower than the body temperature.
Correct.
So that's the reason nature has kept it out of the body in a special sac. But again, if you wear tight clothes, increase the body temperature around the scrotal sac, the sperm production or spermatogenesis is not that effective.
Exactly. And then even diet won't help. So predominantly focusing when it comes to diet, we focus predominantly on zinc, on selenium, vitamin D, omega-3. Now, the reason why we do all of this is zinc and selenium are directly linked to sperm motility as well as the quality. Omega-3 is what forms the base of the energy for a sperm. So if you're having enough of omega-3, your sperm has the energy to swim through the woman's cervical mucus and make its way to the egg. So omega-3 again is super important over here. And again, thinking of the oxidative damage that's caused because of free radicals. Just to break things down in simpler terms, on a daily basis, men and women are exposed to a lot of pollution, a lot of plastics, a lot of endocrine disrupting chemicals is what we call them, which roam around as free bodies in our entire system. So that causes damage to the sperm. So to get rid of that, we add a lot of antioxidant to a person's diet.
So zinc, selenium, antioxidants, and omega-3 fatty acids.
Correct.
But what are the food that they need to eat?
Correct. So when it comes to zinc, right, we focus a lot on zinc and selenium. As a matter of fact, we focus a lot on dried fruits or nuts. So a lot of walnuts, a lot of Brazil nuts. So having 2 Brazil nuts in a day is more than enough to give you the amount of selenium you need. And zinc, again, talking about that, a lot of lentils, legumes, so dals, rajma, chole, things like that, and a lot of seafood as well. Omega-3 again, a lot of fatty fish, a lot of walnuts, a lot of chia seeds, flax seeds, all of this will help with omega-3. And then when we talk about vitamin D and vitamin E, so these I usually supplement only because it's not enough what you're getting through your food. Antioxidants is something that is predominantly present in every prenatal men's supplement. However, focusing a lot of your intake on a lot of fresh fruits, vegetables, making sure that you're having vitamin C rich foods, because that's one of the major potent antioxidant, along with CoQ again is something that can help.
Here I would like to share with you an important study that was done. It says that the semen analysis or the sperm parameters don't just reflect the reproductive health of the man, but they are a reflection or a mirror of the general health as well.
Correct.
So if somebody has a very low sperm count or a poor motility or morphology, it just doesn't mean that their reproductive health is bad. It also means that they need to take care of their health at a more holistic and a broader view.
Correct.
These men have increased tendency to have high blood pressure, diabetes at an early age, or heart-related disorders as well are more in women who have poor sperm parameters.
Correct.
So when a poor sperm report comes along with supplementing the antioxidants or vitamins for their sperm long-term health, it is also very important to work on their body weight, stress levels, daily exercise, and to improve their health at a holistic level.
Yes,
Yeah?
definitely.
Do you think that's right?
100%. I couldn't have said it better.
Yeah.
Yeah.
So, with that, we probably will conclude today's discussion. We spoke in detail about the importance of diet, what to eat, what not to eat, and also at a holistic level, the importance of stress, to avoid the stress, to include exercise, to maintain a healthy body weight, and that you need to give importance not just to the scale, the weighing scale, but to the overall well-being of the individual. So we think this discussion will help you in practicing a healthy lifestyle. If you need any support with your diet, exercise, or your fertility, you're free to contact us. Thank you.